So in today's blog post, what I want to talk about is the link between respiration or breathing and thoracic mobility. So nowadays, nearly every second person says, well, to improve your thoracic mobility, we need to improve your breathing pattern. But do we truly understand what's happening with our respiration system and the link to thoracic mobility? Now, a lot of people will tend to do kind of crocodile breathing and focus on diaphragmatic breathing, and very often get limited results, or certainly not long-standing results, in terms of progressive, sustained thoracic mobility. So when we inhale, the diaphragm is going to drop. Now the ribs are also going to externally rotate. Now when our ribs externally rotate, or our rib cage elevates, and you try rotate your thoracic spine, what you're going to find is you're not going to get very much thoracic mobility. You're going to get a lot more through the lower thoracic spine, upper lumbar spine. So straight away, that's going to have a massive impact on our movement variability to move every which way that we need to move in reaction to certain stimuluses that happen in our sport. Now, when we exhale, our diaphragms are going to pop up, okay, and they're going to lengthen into a dome shape, which is going to allow the rib cage to internally rotate, and straight away, that's going to improve our movement variability. So if my ribs can internally rotate, then all of a sudden I can rotate my thoracic spine in the transverse plane, in the frontal plane, a little bit of both with a bit of sagittal plane. So straight away my movement variability has instantly improved just by increasing the length that I can get through the diaphragm. Now that's very, very important, especially if you've had limited success with crocodile breathing or any type of breathing retraining that just focuses on breathing through the belly here, because this part isn't necessarily the important part that's going to allow the diaphragm to lengthen. It's actually the exhalation phase of respiration that's going to couple with that internal rotation of the rib cage to improve our movement variability. And that's what I cover for about 10-12 days on the Essentials of Injury Prevention, is all about how to improve the ability of the diaphragm to lengthen, internally rotate the rib cage, and then your movement variability is going to instantaneously improve. Okay, so it's not a case of your diaphragm being stuck in an incorrect position or whatever. It's just more case that we want that diaphragm to be able to shorten, but most importantly, in my opinion, is to get that diaphragm to lengthen also. We want the ribs to be able to externally rotate, and we want the ribs to be go through a full range of movement and also internally rotate. But that internal rotation of the rib cage relies heavily on that diaphragm. Now that diaphragm also relies heavily on the pelvic floor and a lot of other stuff. So it's not just as simple as giving some people crocodile breathing or teaching them to diaphragmatic breathe, whereas actually if you're getting the inhalation okay, but you're not really getting that exhalation as good as it could be, then you're not getting the diaphragm to lengthen, and straight away then that's probably not going to give you that long-standing gains with thoracic mobility. As I said, we cover it extensively in the Essentials of Injury Prevention, and I also go into it quite in depth in the mentorship as well, especially in the lumbar spine one for back pain, etc. as well. So I hope that was useful, and I hope it's going to make you think about actually what you're trying to achieve with your breathing, and in terms of improving your thoracic mobility, but also what your breathing and retraining your breathing patterns actually doing to the rest of the body also, and its ability to improve your movement variability also.
Hi, my name's Ollie. I'm a physio currently working in professional rugby league. I've been on Dave O'Sullivan's Pro Sport Academy Therapist Mentorship for the past 6 months or so, which has been a brilliant learning experience. Previous CPDs I've been on provide a method, and when trying to put them all together are quite difficult due to conflicting thought processes, whereas Dave provides a system which considers the human body as a whole. The mentorship covers in great detail the respiratory and neurological systems, in addition to obviously the musculoskeletal focus, but how these all interact is where it really comes into its own. The mentorship has provided me with skills to assess the person in front of me and not just a particular pathology that walks in through the door. And it's taken a lot of the guesswork out of what I do and allows me to clinically reason everything I see. I've seen a huge improvement in my treatment outcomes with the players I work with on a daily basis using Dave's system. This mentorship is by far the best CPD program I've done, and I'd highly recommend it to anyone who's looking to learn an innovative approach to assessment, treatment and rehabilitation to get their patients or clients pain-free with long-lasting effects.
The Sport Academy Mentorship Program with David O'Sullivan has been a fantastic learning experience, and it has radically changed and improved my clinical practice. It goes far beyond any learning you may have gotten in your degree or in the weekend CPD courses. While science-based, it's very practical, and whatever you learn you can directly apply that day in clinic. It goes far beyond your orthopedic tests in terms of diagnosis, and the treatment techniques on it again have shown to be far superior in terms of getting results quicker and results that hold up to sporting demands. It really is excellent value, and I couldn't recommend it highly enough.
I've done most courses on the market with the Pro Sport, Physio, Mentorship. With the detail and treatments that he's gone into, Dave has taken many different methods and procedures and distilled them down into a complete system for injury rehab. We have covered a lot of different areas, from skin, fascia, movement, and placing them into a complete system to find out exactly where the client has the issue, so your treatment is pinpointed to get the best and fastest results.